The impact of alcohol consumption can not only affect individuals, but also ripple out to families, friends, and communities. It can lead to avoidable deaths, poor health, and large financial costs for the NHS and wider society. It is clear that more alcohol leads to more harm, and those who drink heavily are more likely to experience harm. So, helping people who drink heavily consume less alcohol will reduce harm. But what's concerning is that less than 10% of people who drink heavily receive essential face-to-face support from a healthcare professional, because of issues such as lack of time for and low confidence about discussing alcohol with patients. And this is where digital tools could play a role. In the UK, 84% of the population has a smartphone and therefore has access to a digital tool whenever and wherever they might need it. The Drink Less app is a digital tool developed by scientists in collaboration with the public and is independent of any alcohol industry funding or influence. It's based on evidence and theory and designed to help people reduce how much they drink. It's a well-established and highly rated app that has been used by over 70,000 people and has been making a significant impact since its launch in 2016. From 2020 to 2023, researchers evaluated whether it was effective and cost-effective. 5,602 people who drink heavily were recruited who wanted digital support to cut down on their alcohol consumption. Half were randomised to use the Drink Less app and the other half were randomised to viewing the NHS alcohol advice webpage. A quarter of those included earned less than £26,000 and about 45% did not have higher education qualifications. Participants were followed up over 6 months. The study found that the Drink Less app outperformed the NHS alcohol advice webpage. Those who used Drink Less cut their weekly alcohol intake by an additional 2 UK units compared to the NHS alcohol advice webpage. The app was similarly effective for people of different socio-economic groups. Long-term modelling shows that if GPs start recommending the Drink Less app to people who drink heavily, there would be a net cost saving of over £500 million to the NHS over the next 20 years. It would also reduce unfair and avoidable differences in health between the most and least deprived in society. So what does all this mean? It means the Drink Less app is a valuable tool offering effective, affordable and accessible support through a scalable approach. It has the potential to improve the landscape of alcohol reduction in the UK while contributing to reduced healthcare costs. Apps like Drink Less can reduce the burden on healthcare systems and play an important role as part of a comprehensive strategy to prevent and reduce alcohol-related harms. It's time to invest in promoting evidence-based apps to reduce alcohol-related harms and enhance the well-being of the UK population.